Hi, welcome to ABPA Spotlight on one of our fantastic doctors. With us, we have Dr. Farron Hunt, and we are going to let her tell us about what she does in her practice. Thanks, Dr. Hunt.
Awesome. Thank you, Danielle, for the introduction. So I am a family physician and I currently practice at Austin Regional Clinic in Manor. And I've been there for about 3 years now. And we've been very busy from the beginning, given that Manor is an underserved area for Black and Brown, especially. So it's been a very rewarding experience to be, a family doc in a more rural setting just outside of Austin. And within my practice, we see some of everything. I really enjoy seeing teenagers and adolescents, but I love seeing my older patients, people with their families. And so that's really rewarding as well.
Great, awesome. What do you love most? I hear you really enjoy what you do just in your description of it, but what do you love most about what you do?
So I would say getting to have that opportunity to change their mind or improve upon their vision for themselves. I tell patients, it's like, let's write your story, the story you think you may have. Are we on track to reach that? And what can I do to help you fulfill that story or fulfill that dream? And so I try to frame their health goals in terms of helping them to be more realistic about what's possible and expanding what's possible. So that's kind of rewarding for me, especially dealing with a lot of my Black patients, because oftentimes we don't know, what we should do with our health. And so it's nice to be able to kind of help guide them on that journey.
Yeah, I mean, seeing people reach their dreams, that's a pretty awesome part to like
Mm.
about your. So I'm sure you've had people say interesting, funny, or surprising things to you. What's one of the most funny, interesting, or surprising things maybe a patient has done or shared with you?
Uh, so offhand, I can't say it's one specific thing, but in my relationship with patients, I often refer to them as friend. And so I wasn't expecting, for it to be a two-way street. So I've had patients, teach me about gardening, teach me about raising livestock. Now that I'm pregnant, I've been getting advice and support on naming the baby and what to do when. And so it's been a sweet and rewarding kind of feedback that the patients have given me in non-medical ways just to kind of enrich my own life. So I'd say that's been something interesting and rewarding about being here at Manor.
Yeah. Well, congratulations on baby Dr. Hunt.
Thank you.
Yeah. What do you wish all patients knew? If you could tell all the patients you had one thing, what would it be?
It would be to ask questions. If we talk about the plan and you're not sure about something or you don't think that sounds like it fits you, let's talk about it. Let's think about it some more. Let's plan again to kind of make the plans that you have more catered towards what you're looking for personally. And so I wish more patients would ask questions because I love to explain and to take feedback to see what's going on to help kind of better guide the care plan.
Right. Okay. And last question, what excites you most or what do you love most about Austin Black Physicians Association?
So that's an easy answer. The fact that it exists. I've been here 3 years and actually found out from my OBGYN, Dr. Thopel, that, this group existed. And I was like, really? There's a group to support us? And so that was pretty, insightful. And so I joined right after that. And so it's just nice to know that there's a network of other Black physicians that are looking to network and get to know each other on a personal level, not just professionally. It also helps me to be able to have a reference for my patients when they say, "Oh, I want a Black dermatologist," or "Do you know a Black GI specialist?" It'll be like, "Okay, I actually have met this person. They seem nice. Their practice is like this." And so it helps me to give more personal advice to patients, even not only just enriching my own life. So that's my favorite thing so far as a new member. I look forward to giving back with students and residents in a mentorship capacity as well.
Okay. Well, thank you so much. We're happy to have you as part of the group, and we're excited to both support each other, but also to give back to the people who have helped us to get where we are. So Yeah. Thank
so much.